Every day, researchers are discovering which medicines, diet, or lifestyle changes may improve your health and help you stay healthy. Clinical trials are one way scientists discover what works and what doesn't.
Will every medication behave the same in every woman or every man, whether it's a Native American, whether it's a Black American? We don't know. And that's what research is about. That's what clinical trials are about.
To benefit as many of us as possible, clinical trials need diversity among the participants and depend on the help of volunteers.
It's important that we participate in clinical trials because how else can they know what works?
If we're not participating, then the results may not be the kind of results that can help us.
During the next few minutes, you'll learn what a clinical trial is, the risks and benefits, why it's important for African Americans and other minorities to participate, and the safeguards in place to protect you. The knowledge you gain will help you in making an informed decision about participating in a clinical trial. The power is in your hands.
We have a long history of coronary artery disease that run in my family, dating back to my grandmother, who passed away in her early 40s. My mother passed away at 38, the very young age of 38, and a number of uncles in their 40s as well who've passed away of heart disease. I'm sure that the medication that I'm taking now and some of the other heart medications that are out there, they would not be available without clinical trials.
The clinical trial is at the core of most medical research. It is a careful, step-by-step process that studies or tests a new procedure, drug, vaccine, or device.
A clinical trial is a study. It can be a study of new techniques, new procedures, or new medications. The clinical trials are often set up by the government, set up by private industry, set up by corporations or foundations.
There are many types of clinical trials. For example, a trial might test a new device, like a blood glucose monitor for diabetics, or a range of motion machine used in joint rehabilitation. Other trials test how lifestyle changes, such as getting more exercise or how changes in diet affect your health. However, the majority of clinical trials test new drugs. These trials are designed to make sure that new medicines work and that they're safe before they're used by the general public. Clinical trials can take place in large medical centers or hospitals, as well as in your doctor's office or the local community health center. Many of us can recall the long past history of mistreatment that African Americans endured in the name of medical research.
The past, that was really a very dark period in our history in this nation, in which the Tuskegee study, as horrible as it was, which allowed African Americans to be untreated with known syphilis, and there were therapeutic interventions available.
As a result of the Tuskegee outrage and other abuses, federal laws and mandatory safeguards are now in place so that it can never happen again.
I understand fears and there is a lot of mistrust in the African American community about studies, about a number of things.
That's what we call a healthy paranoia. I mean, that makes sense that you should be concerned. But I think if you look at what's in place now, that every trial is as safe as it can be and is evaluated on a number of criteria that would serve to prevent any of the kinds of things that happen.
Institutional review boards serve as another layer of protection. They're made up of members of the community, such as ministers, health advocates, and medical experts, whose responsibility it is to approve the clinical trial and monitor all of its activities.
From the left
Another important safeguard is the process called informed consent. When you discuss the clinical trial with the doctor or nurse, he or she must tell you the possible benefits and all known risks associated with the study.
You have a lot of choices about what kind of studies you want to be involved with. You can have some control in it. You certainly have a right to the information.
I would suggest that they read all of the information that they're given, that they give some thought to it, that they decide that, again, that they can make an informed decision.
They need to talk to the researchers. They need to understand what's going on with that tissue that they donate for study and what are the nuts and bolts of what we do in the lab.
Before you agree to enter a study, it's important that you understand the information that has been given you. Remember that you make the decision whether or not to volunteer to be a part of the study. Unfortunately, the people volunteering to join clinical trials are mostly white men. Because of the lack of diversity in participants, the benefits realized from clinical trials have been slow to reach the African American community.
African Americans are in a minority participants in this clinical trial approach. You know, clinical trials allow us to advance the frontiers of medicine.
So if it's only whites who are part of the clinical trials, then all of the observations are based upon looking at the white population.
So that when African Americans take drugs, for a number of reasons, often they haven't been looked at in our population. So sometimes the side effects are unpredictable.
So I encourage, when appropriate, that our patients and our physicians consider using clinical trials to advance medicine, yes, and to help treat patients more effectively.
It's important to understand that in any clinical trial, there are always some possible risks. These risks could be minor or serious. Before you agree to participate, the doctor or nurse should tell you about any known risks or possible side effects.
There can be side effects from the drugs. The drugs may not work the way they were predicted, but generally many of those potential problems are weeded out by the process.
Philosophically, people would say that life is a risk, and we take them all the time. When you have a disease that you know will eventually kill you, or could kill you, but at the same time there is information available, you decide to take the risk.
I think too often there's the misconception that if you're in a trial looking at a procedure or a process and you happen to be in the group that gets B instead of A, that you're not getting treated. That usually is not the case. Especially for serious illnesses, you are getting treatment, but some of the treatments may be different.
Clinical trials are also an important part of preventing disease as well as finding cures for disease. If you're at risk for a disease such as hypertension or glaucoma, clinical trials might help you learn ways that may prevent you from becoming ill.
The individual in many instances will benefit him or herself, especially if it's a new cancer treatment that may in fact not be available any other way, and that may turn out to be a new way to cure the cancer or to lessen the effects of the cancer. So it does mean that you can often have access to new medications, new treatments before they become widely available.
Hi there.
Before you decide whether or not to participate in a clinical trial, learn as much as you can about the clinical trial. Weigh the possible risks and benefits. Talk it over with your healthcare provider and those close to you. The final decision is yours. And remember, you're a volunteer, so you can withdraw at any time.
And once people understand, then they're more likely to be involved in programs and studies. They understand what they're getting into, what's going to be done with the tissue that we use, what we're going to do with that blood work, why we're doing this, what we're interested in. And if you talk to people in plain language, they're interested and they understand it's not that hard and this makes sense.
By your participation in a program, not only can your quality of life with the disease be better, but some people in your own family, in your immediate family, may benefit from your willingness to participate.
I have a son and a daughter, and there's diabetes on both sides of their father and their mother's family. So, you know, this could have an effect that if they learn something in this study that can help my children or grandchildren if I ever have any.
You now have the power and the knowledge. The next step is yours.